One question that many of you are probably asking is just how cold should the water be? Well, you could mimic what was done in this study and do 14 degrees Celsius, but for some people that won't be cold enough. For some people that will be too cold. They did look at the release of stress hormones like cortisol in addition to the release of things like epinephrine and adrenaline. And it's interesting that they noted that in all cases, but especially at that coldest temperature, there was an increase in cortisol, but that it was transient, that eventually people's cortisol, the stress hormone, subsided a bit. There are basically two different approaches to remaining in the cold when it's uncomfortable. One is to try and relax yourself, to try and practice slow breathing, to try and dilate your gaze. I've talked about this before in previous podcasts, to go into panoramic vision, to essentially try and calm yourself so that it's not as stressful in the cold. Other people, however, take the approach of trying to ramp up their level of internal autonomic arousal, meaning to get really energized and kind of lean into the friction of the cold, and they find that easier. Other people distract themselves. They recite the alphabet or they do anything to try and distract themselves from the discomfort. To be totally honest, it does not matter for sake of dopamine release, because the dopamine release is triggered and then continues even after you get out of the cold water. Now, in this study, it was long exposure to cold water. It was an hour. That's a long period of time. And I do warn you against getting into cold water that's so cold that it will make your temperature drop and make you hyperthermic for an hour. That actually could be dangerous for a lot of people. You might have a hard time reheating, and hypothermia is not a good thing. They had people monitoring subjects in these studies and paying attention to their core body temperature. They were able to reheat them afterwards. It's well established now that getting into cold water, whether or not it's a shower, an ice bath, circulating cold water, a stream, etc., that can evoke the norepinephrine release immediately and the long arc of that dopamine release. Why would that be good? Up until now, I've basically said getting increases in dopamine are detrimental to your baseline. Well, this does appear to raise the baseline of dopamine for substantial periods of time, and most people report feeling a heightened level of calm and focus after getting out of cold water. So cold water exposure turns out to be a very potent stimulus for shifting the entire milieu, the entire environment of our brain and body, and allowing many people to feel much, much better for a substantial period of time after getting out of the ice bath or cold water of any kind than they did before. Now, you might ask how often to do this. Some people do this every day. It can be very stimulating, so typically doing it early in the day is going to be better. I don't necessarily recommend doing it right before sleep, but some people do it in the afternoon, and some people will indeed do that 7 days a week. Other people 3 days a week. Other people every once in a while. What I can say is once you become cold water adapted, once it no longer has the same impact of novelty and feeling a bit like I don't want to say a shock to your system because you don't want to go into cold water shock, but once it is comfortable for you, then it will no longer evoke this release. There really does seem to be something in the pathway from cold water exposure through the norepinephrine pathway and into the mesolimbic brainstem that causes this release in dopamine. But nonetheless, it's a basically zero cost. I mean, you need access to water of some sort, cold water, shower, etc. But basically zero cost way of triggering a long-lasting increase in dopamine without ingesting anything, no pharmacology whatsoever. Please, again, approach it with safety and caution in mind, but it is a very potent stimulus. Again, 250% rise in baseline, 2.5 times rise in baseline rivals that of cocaine, which is really remarkable.